Well, to something entirely different. I came via a rather circuitous route into the world of broadcasting, courtesy of a man by the name of John Brennan. It is an often misplaced thing to say about people, but John Brennan was the living embodiment of what we believe to be the spirit of true Christianity. I was coaching the Wallabies. We'd just won the Grand Slam in 1984, which had made history. I'd never met John Brennan. And one Sunday morning, I answered the phone. I had just addressed the National Press Club the previous week, and this booming voice announced himself as John Brennan, and I think you should be in radio. He invited me there and then to do a dry run. I'd never been in a radio station in my life. I got through all of that, but Brenno wasn't one of the decision makers at Sydney's 2UE. He presented the tape to the program director, who I kindly won't name, who assured Brenno that, quote, this bloke won't work in radio. Brenno was undeterred and, acting outside his mandate, really pursued the matter for several days, and eventually I made the decision to give it a go. From that point on, I owed my success more than anything else to this remarkable human being, John Brennan. Now, I know you're wondering where I'm heading here. Well, stay with me, because next Sunday, October 10, there'll be a 1-hour documentary on the late John Brennan, aired on Foxtel's dedicated documentary destination, Fox Docos, and on demand at 7:30pm. 7:30pm next Sunday, the 10th of October. It's been produced by the best, Graham McNeice, narrated by Tim Webster, a wonderful human being. It's rightly called The Kingmaker, John Brennan. Brennan passed away early this year, leaving a wife and 2 sons. He lost his daughter from cancer some years ago. Nothing gave Brennan more pride than his family, one of whom is Dr. Richard Brennan, AO. Richard Brennan is the Regional Emergency Director of the World Health Organization's Regional Office for the Eastern Mediterranean. He's based in Cairo, Egypt. I argued some years ago, in fact, that Dr. Richard Brennan should have been the Australian of the Year. We have our coronavirus. Richard spent 7 years at the World Health Organization headquarters as the Director of Emergency Operations, Director of Ebola Coordination and Response, and the Director of all WHO's Emergency Risk Management and Humanitarian Response. He and his wife virtually have no home. They're constantly being moved to where the latest health crisis is. Dr. Richard Brennan has worked in 35 countries across Africa, Asia, the Middle East and Eastern Europe. He's a graduate of Sydney University. He won a clinical and research fellowship to the United States. He has a master's degree of public health from Johns Hopkins University. He's worked with the US Centre for Disease Control and Prevention on humanitarian, chem, bio, nuclear and civil military issues. I remember talking to Rick prior to joining the WHO, where he spent 2.5 years in Liberia. Liberia endured a civil war from 1989 to 1997. 200,000 people were killed. Rick Brennan was called in to oversee the reconstruction of the whole Liberian health system. I was very close to his parents, John and Jenny. Jenny's watching tonight. And I know the parents lived many nights of anxiety worrying about their son. Well, to the point of all of this, Rick and his immediate boss, plus the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, flew to Afghanistan a fortnight ago to meet with the Taliban. The reason being that the 3 main donors to the previous Afghan regime's health system, the World Bank, the EU and the US, the big 3, have pulled their funding as they're not permitted to give money to a terrorist organisation. So the WHO met with the Taliban and Dr. Richard Brennan. This is a phenomenal honour and an awful responsibility for a distinguished Australian, but it's an enormously difficult mission. Dr. Rick Brennan joins me tonight from Cairo. Rick, lovely to talk to you. Thank you for your time. So down to business here. You are meeting with the Taliban to convince them to allow the World Health Organization to manage the distribution of the donor funds if the big 3, the World Bank, the EU and the US, would agree to those terms. Now, am I right in saying, I mean, you've been here before, but that without these funds, the entire Afghan health system would collapse?
Yeah, that's the big worry, Alan. It's a critical situation. As you rightly said, those big donors, they have their own rules and regulations that won't allow them to support a government authority such as the Taliban that has terrorist ties. So what we have to do is we're coming up with a stopgap measure right now. We've gone to other donors and together with UNICEF and the International Committee of the Red Cross, we've got funding for about 4 months to support these 2,300 clinics and hospitals. And during that period of time, we'll ensure the delivery of health services. But we also have to negotiate with the big donors for the longer term because The Afghan economy is in the tank right now, and there's no other way to support health service delivery.
Rick, just physically, what did the place look like when you landed in Kabul?
Well, it was slow. Life is slowly coming back to some level of normality. Markets were open, cars on the streets, people on the streets. I certainly didn't see as many women and girls on the streets as I had on my previous visit about 12 months ago. But they were out there. We saw schoolgirls walking to their classes. We saw a lot more veiled women wearing burqas and veils. But we also saw young women with their faces exposed. So it's different from what it was 12 months ago, but some level of normality coming back.
Was any of this business raised, and I'm sure the WHO and your advisors knew this, about the new cabinet, where people like this fellow Haqqani is the deputy Taliban leader and head of the Haqqani network? He boasts responsibility for a Kabul truck bomb in 2017 that killed 150 civilians. He's got an FBI bounty on his head of $5 million. He's the interior minister with unlimited power to impose extreme Sharia law. Now, would the WHO, the World Bank, the EU and the US donate money to a nation that imposes extreme Sharia law?
No, I think what's going to happen is previously those three donors had channeled money through the government for the delivery of health services. Now we're looking for an alternate mechanism that they can channel their money to another structure outside government, perhaps through the United Nations, perhaps through WHO and UNICEF, so that we can manage the distribution of the funds to make sure the clinics and hospitals keep running. But they're not going to give it to the government at this stage.
No. So you met with the Prime Minister, Mullah Hassan Akhund, who's been part of the Taliban leadership since the 1990s. He's the interim Prime Minister. He wasn't involved in this is the benefit of my viewers, the Soviet-Afghan War of the 1980s. He is described as a more religious influence in the Taliban, but he was responsible for the destruction of the giant Buddha cliff statues, which were destroyed by the Taliban in 2001. So where do his past and so on fit into your deliberations? I mean, what kind of briefing were you given before you went there?
So, Alan, we're focused on the humanitarian needs. We don't get involved in the politics, but we have to be mindful of the politics. You have to be technically smart, humanitarian in principle, but also politically aware. So our focus was really on how we make sure the most vulnerable Afghans get access to healthcare. I believe that he and his cabinet members, including that new Minister of Health, were very sensitive to those issues. They realised that they need the international community to help them. Otherwise, their women and children won't get, basic health services. So that was essentially the focus of our discussions. He asked us what our priorities were.
Were you sorry, Rick, but were you convinced when it was all over and you left and went back to Cairo that they would make some adjustment to the way they had previously run government in order to meet these kinds of international standards?
Yeah, I think the jury's still out on how far they will go. So, Alan, my first visit to Afghanistan was 21 years ago when the Taliban was in power. It's a very different atmosphere then. I think that they have progressed in a number of areas. We subsequently had a 3-hour meeting with the new Minister of Health on his first day in office. And we agreed on what the priorities are moving forward. He subsequently has committed to us that he will support our some major vaccination campaigns across Afghanistan. There's a big measles outbreak right now. We've got COVID. Afghanistan is one of only 2 countries where the wild polio virus is circulating. So he's agreed to give us access and support to do these campaigns. And he's really encouraging us.
What sort of money are we talking about, Rick? What sort of money are we talking about?
Well, for the next 3 to 4 months, we've secured $45 million from the UN, UNICEF and WHO, and then the International Committee of the Red Cross. They're probably bringing in around 10 or 15 million of their own. That'll get us through till perhaps the end of January, February, and then we're going to need more funds. That doesn't include all the funds we need for the COVID response. We probably need another 12 million there. So we're up to $60-70 million just to get us through the next 4 months.
Amazing. My God, you've done a wonderful job. 35 countries you've been through. Rick, we'll keep in touch. As your mum and dad would say, and your dad always said to me, God, I hope Rick is safe. So there he is. He's in Cairo. He's safe there. And to our viewers out there, don't forget that documentary on Rick's dad, the great John Brennan. It'll be aired on Foxtel's dedicated documentary destination, Fox Docos, and on demand at 7:30 p.m. And Jenny, I know you'll be watching. That's 7:30 p.m. next Sunday, the 10th of October. It is appropriately called The Kingmaker, John Brennan. Thank you, Rick. Stay well, stay healthy. Lovely to talk to you. There he is, Rick Brennan, Dr. Rick Brennan in Cairo.